Hello, hello, and welcome to the Dr. Toomer Talk Show. I am Dr. Catherine Toomer. I'm a family medicine and community health physician, as well as a metabolic weight management specialist. I'm also the founder of Your Light Wellness and Weight Care Group, which is a group of very dedicated physicians who care. And as our tagline is, know that we care and care that we know. We are a group of physicians covering the United States, including Alaska and Hawaii, and for to fill the gaps of metabolic weight care. People are losing access to their medications for metabolic correction, and we are doing something about it. So you can ask me more questions about that later, or you can email me at help@drtoomer.com, not just for this, but also for any questions that you might have. And I got a few questions for tonight as well. And so I try to do at least one Q&A a month just to let people, excuse me, ask the questions that they want, that are burning in their minds, rather than choosing topics myself, which is effective to the most part. I also like to hear from you so that you can tell me what it is that you have questions about. So if you're listening, please let me know. Say hello. Let me know where you're listening from and ask your questions in the chat. Now, if you are a little bashful, because some of the questions can be quite personal, if you want, you can write help@drtoomer.com and I will read your question anonymously. So I do have a couple of questions that have already been sent to me, and I will read those later. So hello, Marcia. Thank you for joining in from Barbados. I wouldn't know where I was if you wouldn't show up. So, all right. Well, since there are no questions in the chat, I'm just going to read the questions. I got a few that I got in the email. So if you just bear with me, I thought I had pulled them up, but I hadn't. Okay. Here we go. Okay. Whoa. All right. Um, I'll start with one of the easier questions. Is basically from a patient who says, I have been taking a medication, a GLP-1, for 2 months, prescribed by another doctor. I am taking Zepbound, which is tirzepatide, the GIP GLP medication, for 2 months, and I haven't seen any change in my weight, any change in my appetite suppression, or any change really at all. But I also, on the good side, have not had any side effects either. Okay, so I'm just going to reiterate again that GLP-1 medications are what many people refer to as weight loss medications. They are the Ozempic, Wegovy, Mounjaro, Zepbound, or the Trulicity, Victoza, Saxenda, and what we use to help people um, lose weight. However, what they truly are not weight loss medications. What they do is they treat the cause of our weight gain. Now, those of you who are like I am, we have a lot of metabolic dysregulation. We're on the continuum for diabetes. Many of us are walking around not even knowing that we're on the continuum of diabetes. There are a few things that can put you there. One is your genetics. That's the most common. The other is when your genetics meets environment, stress, age, polycystic ovary syndrome, pregnancy, menopause. All these things can cause a trigger in your genes that will turn on a glucose dysregulation, which then makes your body very efficient at making fat out of food. So like some people, you have two different people. One person can eat the same thing as somebody else. One person makes fat, the other person makes fuel. Well, genetics are what determine that. So when taking the medication, it helps correct that dysregulation. However, the lower doses are not therapeutic. They're simply designed to help prevent your body from reacting to higher doses and having side effects at higher doses. So these medications are dose dependent, and that dose dependency is different for every single person, meaning that each person may react or may respond to a different dose. And so when it comes to Zepbound, that dose goes from 2.5 milligrams up in 2.5 increments. So 2.5 to 5, 7.5 and 10, 12.5 and 15. So you can see that 2.5 is very low compared to the maximum dose, which is 15 milligrams. And so you shouldn't expect to see anything. If anyone has any changes on the lowest dose, that is simply a bonus or that they are hypersensitive. Most people do not. Many people don't even notice any change until they get to 10 milligrams. And the way we get people there, it's considered what's called a titrated medication. You titrate up from 2.5 to 5, 7.5, 10, and you go up at least once a month. You do not go up any faster than that. And because otherwise, what that does is it puts you at risk for side effects, which is nausea, vomiting, diarrhea, or constipation, or any of the other complications, which are rare, but they can happen. Or what it does, it causes rapid weight loss. And that rapid weight loss then leads to gallstones. And those gallstones then cause problems. So you want to lose weight slowly, and 2.5. And so more than likely, if you're not having side effects, and you're on 2.5 milligrams, then your doctor will probably put you up to 5 milligrams the next time you speak. So I would say follow up with your physician and get your dose changed. All right. Assuming that you don't have any contraindications for why that can happen. Now, I did mention that Zepbound is 2.5 and 2.5 increments up to 15. Wegovy starts at 0.25, then 5. It kind of doubles each dose until you get to 2.4 if you're on Wegovy, or 2 if you're on Ozempic. And so, even though Trulicity has not been indicated for weight management, it is used for weight management because it is also a GLP-1 medication. And those doses are just the same as they would be for diabetes. So that was the first question. If anyone has any other questions, they can put them in the chat, or and please let me know who's listening and where you're listening from, and say hello. All right, let's see what the next question is. Oh, interesting. Is it true that there is a female Viagra? That was very direct. All right. Well, yes, there is something that's come very similar. Now, the difference is, so what Viagra is essentially is a medication that acts on smooth muscles of blood vessels, and those smooth muscles of blood vessels, when they're relaxed, they open up, and that those vessels fill with blood. Now, for men, what that does is it causes an erection. Now, for women, what that does is it can cause your clitoris to be more sensitive. However, there are other substances or other things that do the exact same thing, except they're topical. So instead of having to take a pill, it is more topical than, and so it makes the clitoris more sensitive and therefore orgasms easier. Now, that affects sensitivity. It does not affect desire. Desire generally comes from testosterone. That's for both men and for women. So if you have what's called a low libido, meaning that you have no interest in sex, there are a couple of reasons. One can be psychological, that you just don't like your partner very much, and that's a possibility, or they make you angry. The other is that you have some underlying psychological issue going on, like depression or anxiety. And so that also has to be addressed in order to then become more social and more interested. And then the other is hormonal. So usually with the drop in estrogen and progesterone, you may not see as much of a change. It's usually the drop in testosterone that causes the drop in libido, both in men and both in women. However, so hormone replacement in those cases then raises desire, But when it comes to the physiology of the ability to engage in sexual activity, that requires, for men, it requires circulation, good circulation, and so they can have erections. And for women, it also it requires lubrication. Now, as you get older, as you go into menopause, lubrication can become a problem, and hormone replacement can help with that. Now, it can either be oral hormone replacement or vaginal hormone replacement, because what it does is it prevents the lining of the vagina from getting thin. Because when the lining of the vagina gets thin, sex becomes painful, and urinary tract infections become more easily to get. And urinary tract or bladder infections may seem like they're benign. However, when left untreated, or if you just don't feel it, it infects your bladder, then infects your kidneys. And when it infects your kidneys, it can infect your blood. And when it gets in your blood, it causes sepsis. And when it causes sepsis, it is dangerous. It can be fatal. So that's why urinary tract infections are so important to catch early and to treat, preferably to prevent. So that's what vaginal hormones do, or even systemic hormones do for women. So it maintains lubrication and it maintains the integrity of your vaginal lining, epithelial lining. So that was a long answer to say, yes, there is something that can be done. And I would recommend talking to your gynecologist about these things. Usually they're not covered by insurance. However, there can be obtained through compounded pharmacies. I have a compounded pharmacy that I use where we have those medications for sexual pleasure, sexual health for both men and for women. So if you feel that might be something you need, you can always contact me at help@drtoomer.com, and I can connect you to a doctor in your state, or I can help you myself. Question: can GLP-1 medication affect your desire too? It actually can. And the reason is because it affects the pleasure centers of the brain. It affects the reward centers of the brain. It's the same reason why we don't tend to, it makes us stop turning to food for reward. And unfortunately, our sexual desire often falls in that same area of our brain. And so it can do it that way by decreasing the reward center's reaction. The other thing that it can do, though, is sometimes GLP-1s can increase depression. And when depression increases, it does affect our desire. So sometimes what that would require is some intentionality in, and usually often is foreplay just has to extend a little longer. And sometimes it's just the beginning that's difficult, but once you start, it's the rest of your hormones sort of kick in. And so, but yes, GLP-1 medications can. Now, if it gets to the point where the desire is gone and it's affecting a relationship, this is why we talk about biopsychosocial, because this is a social part of that. There is a point where you can decide if you could drop the amount of medication you're on and get that desire back while also maintaining your weight loss. There's always a balance. And I do this often with appetite suppression. If someone's appetite for anything has dropped to the point where they're losing pleasure in life for whatever reason, or something that they enjoyed before, it may come to a point where dropping the medication and losing some of the weight loss benefit is actually better, because overall it's a benefit to your life. So yes. The next question: what else is Ozempic used for besides weight loss? Ozempic is actually used for diabetes control. It's for type 2 diabetes. Now, Ozempic is used for type 2 diabetes. Wegovy is used for weight management. They are exactly the same medication. They are both semaglutide, just different names, different indications, based on FDA approval and the pharmaceutical company request. And so it is often used. Now, one of the things that we are starting to use it more for, particularly off-label. We started using it off-label for weight management, which is how we knew that it worked for weight management, and that's how Saxenda came about. Many physicians in many situations use medications off-label for their benefit. We use seizure medication for mood stabilization. We use all, like I said, there's just many different ways we use medication off label. And this was one of them. One of the things we found that that the GLP-1 medications like Ozempic help with is addiction, which is what I was talking about right before, about the desire and the pleasure centers of the brain. The other that it does is that it reduces inflammation. And so it regulates sugar. Sugar causes inflammation, and so it regulates that. And so it will drop inflammation. I've had many patients who have arthritis who've said that their arthritic pain has drastically decreased. The other that it does is that it can be mood stabilizing for depression and anxiety. It works on fatty liver too, because any metabolic process in the body it works on. And so, yes, weight is just a symptom of one of those metabolic processes, but pain is another, visual changes is another, kidney issues are another, brain fog is another. So it helps with dementia prevention, and that's being studied right now. So yes, there are lots of other benefits for the medication besides just weight loss. Weight loss, I guess I said, is a symptom. Weight is a symptom. So it can help with weight-bearing joints. It can help with self-esteem. It can help with metabolic problems in the body, because fat in and of itself can cause issues in the body. So it helps reduce fat. So it helps with that. And so, yeah, there are lots of benefits, many, many benefits beyond weight control. I am taking Mounjaro. I've lost 50 pounds. However, any suggestions for crappy skin, thinning hair? Okay. Skin, flappy skin is the privilege we enjoy for getting healthy. I would, it's better to have flappy skin and stretch marks than the medical issues that go along with being overweight and obese. As someone who has been 100 pounds heavier, I can tell you I much prefer the feeling of feeling healthy in a smaller body, because now my body functions in the way that I like it to. Now, when it comes to thinning hair, there are a couple of reasons why that happens. It's usually not because of the weight loss. It's because of the nutritional issues with weight loss. So if you're having thinning hair, there's a couple of things that are happening. Either you're not, there's a couple of things that need to happen. Hydration, definitely need to be hydrated. The other is you have to make sure you get a good complement of vitamins and minerals. So either by eating them or by taking them as supplements, but that is required. The other is to make sure that hair hygiene is also maintained with moisturizers for skin, for ways of keeping your scalp moisturized, and otherwise, if you're someone who has oily skin, obviously you don't want to put oil in your hair, but hair care is really important. Now, it's so interesting because I just did a podcast today, live, with a dermatologist who does hair restoration, and who does, we talked about hair thinning, and dermatologists know how to help with hair loss or hair thinning. And there are lots of different things that can be done topically, like with minoxidil, or with other options, like I said, supplements. So, talk to your doctor, get a referral. If it's really becoming a problem, make sure you're hydrated, make sure that you're nutritionally sound. And then, there are other things that can help. Yeah, I knew, Lynn, I knew what you meant when you said curvy skin. I figured as much. As someone who's lost over 100 pounds, I knew exactly what you meant. And he says, hello, all from Pennsylvania. Hello. I was on and off Trulicity at that. Is that the same? Yes. Trulicity is also a GLP-1 medication. The only difference is that the company that made Trulicity did not have it presented to the FDA for weight management. However, it does help with the same. With each development of a GLP-1, they get better and better. So Trulicity was better than Victoza, Ozempic's better than Trulicity, and Mounjaro, Zepbound, is better than Ozempic for most people. Ozempic, Wegovy. But yes, it does do the same thing. Dr. Toomer, we should do a show together. The Get Up and Get Active crew needs you. All right. Definitely. Write to me. Help@drtoomer.com. I will respond. I do. Yeah, that would be great. Um, let me see. I only taken 4 shots total, but I was having stomach pain. But believe now I was just gassy. So going to see doctor before they start me up again. Yeah. And also because stomach pain could be from gallstones. If you have gallstones, sometimes it can cause some issues. Also, if you have reflux, or if you have like acid reflux, the gastric slowing can sometimes cause pain in your stomach. Also, not eating as much can do it too. So yes, it's a good idea. Go see your doctor and find out why that is happening. Never ignore symptoms when taking a new medication, whether this medication or another medication. Let me see. Oh, so we're talking about was there enjoying it too. Okay. So any other questions? Yeah, one of the suggestions I got was that these were kind of going a bit long, and I do try to keep them in about 20 minutes, at the most 30 minutes. So if you have some other questions, I do have one other question that someone wrote to me, and so I'll answer that. And if anyone has any others, you can just put them in the chat and I'll grab it. Hold on just a moment. Okay, hold on. Yeah, I lost my. Okay. What should I do if I want to lose weight? I want to be healthy. I want to. I want. What should I do if I want to lose weight? I want to be healthy, but I do not want to take medication. Absolutely. There are ways of doing it. It may be a little bit more difficult, but especially depending on the cause of your weight gain. If the cause of your weight gain is metabolic, you can use muscle and mindfulness. Now, this is one of the biggest issues that people forget. Stress can override anything and everything else that you do. If you don't manage stress, weight loss is going to be twice as hard. Managing stress makes weight loss much easier. Not only does managing stress is so important for weight management, but it's important for health. It is a killer. It causes all sorts of changes in the body that causes death. It ages us faster. It causes blood vessels issue. It leads to stroke, hypertension, kidney failure, dementia, all sorts of things. And so stress, especially chronic stress, long-term stress, has such a devastating effect on the body. So the best way to get healthy and to let your body go where it goes is to reduce your stress. Now, that's number one. Number two is building muscle. So if you're building muscle, you want to make sure you have all the building blocks to build that muscle, which requires hormones and requires protein. So you want to make sure you're eating enough protein and that your testosterone levels are where they should be in order for you to grow, to build muscle. When you build muscle, you build your metabolism, you boost your metabolism, and that will then become the powerhouse of your body. It will be the driving metabolic force. Now, sometimes genetics have already kicked in and your muscles are competing with that process. And when your muscles are competing with that process, sometimes it's just too late. We have what we call a bell curve. You may have been the other way. If you get up to the point where you've already started to go down the other side of the bell curve, trying to come back requires treatment. If you're somewhere early on in the process, you can prevent it and reverse it. You can prevent it from getting worse and reverse it from where it's been. But once there's a certain point where you're just not going to be able to reverse it very well without help. And it can be done. We've seen it done, but, people have white knuckled it. And my feeling is why push a boulder up a hill when you can have help with a tractor? It just makes, the process more efficient and much easier and less damage on your body. One activity that works really, really well to help with weight management, health, stress reduction, muscle building is Pilates. I recommend this a lot. Pilates is one of those activities that hits many birds with one stone. It builds muscle, reduces stress, and often creates a community. So it's a social outlet. And that helps with accountability and sometimes just enjoyment more. So Pilates is a really good activity if to start with, and then making sure that you're also drinking enough water and staying hydrated and also getting enough sleep. There are hormones that our body produces during sleep that help with our appetite. And one of the reasons why we eat more when we're tired isn't just because we're tired and we're trying to get an energy boost. It's also because there's hormones involved that are making you want to eat. So sleep is also very important. Dr. Toomer, what are your thoughts on fasting when on a GLP-1? Now, if you're fasting, um, it's not a problem. Fasting has its benefits, particularly, there's many religious fasting. There's, I think we're in Ramadan right now. So, there are a lot of people fasting around the world at the moment. The key is to pay attention to feelings of low blood sugar. If you're fasting for religious reasons and you really don't have a choice, then adjusting your medication may be required. Dropping it, maybe not going off it altogether, but just dropping the dose. If you're fasting for any other health reasons, then you may want to consider either not fasting and just staying on the medication and let the medication do what it does. Because what you're doing, essentially, fasting and the GLP-1 kind of do the same thing with regulating your insulin. And so if you don't have to fast, it's not really necessary, but you just have to be very careful about your blood sugars. Like most of us, we fast anyway, just because we tend to not eat after a certain time. Then you sleep and then you wake up. That's why it's called breakfast or break fast. So it really just depends on how you're fasting and why you're fasting. And again, what it does to your body. Each person is different. Do you know anything about veins in your legs? Yeah, but what about them? Oh, because I had a vein procedure done on my leg with my vein. Now it swells up now. That is something you need to talk to your surgeons about and your primary doctor about, because it may just be that so what happens with veins in our legs? Our veins have valves, and they're kind of inside our veins like this. And our blood pushes up, and then the valves catch it, stop it from going back. And then it goes up, and then the valve stops it from going down. So what happens sometimes is they get leaky or they get loose. And so the blood pools in our leg, and then it starts to leak out, and it makes our legs swell. And compression stocks often help with that. Muscle work helps with that, walking, using your calves, and using your thighs, depending on the extent of it. So generally, when something like that happens and you've had a procedure, there was something underlying, there was something you were predisposed to, and they tried to fix it. And so I would say talk to the person who did the procedure and talk to the person who referred you for that procedure, and figure out if that swelling is normal for where you are in your process. Denise says, okay, thank you. You're the best. Thank you for coming. My knee swells up. It could be arthritis. There's lots of different reasons why your knee would swell. Again, talk to your doctors. There's just, imaging may be required. A physical exam is definitely required, because there's lots of different reasons why your knee could swell. It also depends on whether there's pain, whether there's arthritis from before, whether, your age, your wear and tear. It just really, there's so many different things that are components into what the evaluation would be. It would be very difficult to say without somebody actually seeing you and examining the symptom that you're having. Hi from North Carolina. What can you tell me about phentermine as a weight loss medication? Personally, I don't use it. I prescribe phentermine very rarely, and usually when I prescribe it, it is for very specific reasons. And I use it as needed, not as a daily medication. And the reason is phentermine, for those of you who don't know, is an appetite suppressant. Most people who eat too much are not eating too much because of where phentermine acts. They're eating too much because their blood sugar is being dysregulated and is sending the wrong signal to your brain, and your brain is then sending the wrong signal to the rest of your body. So phentermine does not go after the cause of why someone's eating too much. So stopping them from eating is just basically just starving them without going after the real reason why they're overeating. Most people who are overweight do not overeat. I can tell you as someone who is now 112, 13 pounds, who used to be 100, 220 plus pounds, I eat way more now than I did then. It's not about how much food you eat. It's about what you're eating and what your body does to that food once you've eaten it. Phentermine does not touch it. What it does, though, is put you at risk for heart problems. And it's only supposed to be used at maximum for 12 weeks. And that's because it is a toxic medication. And I do not prescribe it. I rarely prescribe it. In fact, I guess I can count on one hand the number of times I prescribed it. Also, the only other time I prescribe it is for those people who have a very, very difficult time during the holidays, when they go to a lot of holiday parties and they have a difficult time controlling themselves around food. I may give it to them to take just for the days they go to those events. And that's it. But for weight loss, it's temporary. It doesn't treat the cause of it, of why you gain weight in the first place. And therefore, personally, I think it's not a very good medication. I don't use it much. I mean, it works. Now, don't get me wrong. There are some people who may be binge eaters, who have binge eating disorder, who may benefit from it. But again, it's so toxic to the heart that you can't stay on it for too long. Demetrius says, I am just 43. Yeah. Knee swelling, I mean, knee joint pain. So knees are weight-bearing joints. So your weight matters when your knees are having an issue. Age does matter because over time our knees, and also our prior activity. So if you were ever a runner or a gymnast, excuse me, those things can affect your joints. However, the other thing that happens with our knees and swelling, or any joint and swelling, is that, again, blood sugars can cause swelling. So glucose dysregulation can cause swelling, can cause inflammation around joints, and especially painful inflammation. And so, and that's why GLP-1s work so well to help control arthritis. You hear a lot of people who have rheumatoid and osteoarthritis who say their pain is very much decreased when using medication. So, any other questions? Yeah, I just had the 3 emails. So if no one has any other questions, you can write to me again, like I said, at help@drtoomer.com. I'll just put it into the chat. And I or my assistant will see it, and I'll answer or get you to someone who can. If you are looking for help to for weight management, you can also write to me at help@drtoomer.com, and I can either help you myself or I can find someone who can in your state. We have doctors covering almost every state of the United States, telemedicine, to help with helping to navigate this topic, because, and that's not just for weight management. We also do hormone replacement and hair, addressing hair thinning, which is often common in weight loss. And then we also have sexual health as well. So But I'll always try to start with your primary doctor first and your local doctors. And if you cannot find someone to help you, you can always contact me. Okay. I have undifferentiated connective tissue disease. I have lots of pain and inflammation. Any suggestions? Um, Now, I am someone who has always used GLP-1 medications off label. Before even weight management was known, I was using it for weight management. So it's been about 15 years. Inflammation responds very well to low dose GLP-1 medication. The problem will be finding a physician who agrees and has no problem prescribing it for that reason. Insurance companies probably will not cover it unless it's related to what is considered an FDA approved diagnosis, which would be diabetes, type 2 diabetes, or um, a overweight or obesity with some type of comorbidity. So the fact that you have connective tissue disease, if it affects your joints, you may be able to use weight-bearing joint pain as a secondary diagnosis to get help with the medication. Otherwise, it's just cash. You have to pay cash. Unfortunately, it's very limited as to who we can get the medication for. Used to be we can get it for anybody. Now we can't do that. So, um, but yeah, GLP-1s help quite a bit with connective tissue issues. But they're just not indicated for that yet. Hopefully they will be one day. Demetrius says, I need to know why aren't I am not gaining weight. So I don't understand the question. Are you trying to gain weight and you're wondering why you aren't? Or I'm not sure. So if you can write that again and let me know, because why aren't I am not gaining weight? So I'm assuming based on what you've written that you're trying to gain weight. And if you are, then well, just rewrite, just explain. So I am overweight and I was on Trulicity. I'm ready to get back on it. So, if you can, now the thing is with Trulicity, it is not indicated for weight management. Wegovy and Zepbound are, Saxenda is. So if your insurance covers it, that's fine. But there are other better medications for that purpose. And Wegovy and Zepbound are those things. So you're saying so Dimitri, you're saying you're trying to lose weight. Gain weight. If you're trying to gain weight and why aren't you gaining weight? There's a couple of reasons. It can be hormonal, genetics again. Genetics plays a huge role in how our body responds to food. Our metabolism also. Sometimes it could be thyroid issue and overactive thyroid. Depends if it's just not being able to gain weight or losing weight with no other symptoms, then it could simply be your genes, your genetics. So the thing to do is to talk to your physician. The other is to make sure you eat calorie dense foods that are also healthy for you. You can add, eat, like if you have stews, you can add coconut oil to stews. It adds calories and it adds, other things that your body can use. Then sometimes eating small meals several times a day. But you want to make sure that when you eat, you don't eat foods that are going to cause you problems down the road, like high fatty foods that can cause heart disease later. Shamika says, I did blood work and they say I have high potassium and my blood pressure was 104.76. So I'm torn between the two. Where should I go with this? Blood pressure usually is not written in that way. So I'm not sure what that means. So if it's blood sugar, maybe, I don't know. But high potassium, it really just depends. Sometimes high potassium could just simply mean that the person who drew your blood, you had what's called a traumatic blood draw. And so potassium's high. If you have high potassium, high blood pressure, definitely you want to talk to your physician And you want to talk to a cardiologist, can probably be the next best person, because they deal with the problems with potassium and high blood pressure affect your heart. And so seeing a cardiologist may be helpful, because really potassium is what our heart uses to help it beat. And so when your potassium's off, having your heart problems are the biggest issue that you worry about when your potassium is not corrected. Okay. Demetrius, I'm trying to see what I need to do to gain some weight. Now, if you're underweight, I understand that. If you're not underweight and you're just trying to gain weight because you just want to look a certain way, it probably is not going to be that easy, because your genetics determine whether you gain or lose weight primarily. So, wanting to lose weight, gain weight, and needing to gain weight are two totally different things. Why is the GLP-1 med so expensive? Because big pharma are greedy. Well, really, it's because it costs a lot to develop medications, and we bear the brunt of that cost. Other countries do not, but we do. It's expensive because they know people will pay for it, and people are paying for it, and they're making a whole lot of money because of it. Weight, and it's $1 billion industry, so that's why it's always in shortage, because they know people are going to pay for it if it's available. Teresa says, I was losing weight with Trulicity. I wanted to try again for my connective tissue disease. I'm taking hydrochloroquine. Okay. And if it works, that's good. If you can get it and you can get it covered and you can get it paid for, absolutely. And your doctor agrees, then, so my blood pressure on top number was 104 and the bottom number is 76. So that means your blood pressure is low. On the lower side. It's still fine. It's only if you're symptomatic that it matters. If you're dizzy, you get lightheaded when you stand up, you kind of feel sluggish and tired. But that blood pressure in and of itself, I walk around with a much lower blood pressure than that all the time. It just depends on the person and your symptoms that you may be having. But definitely, and if you're on any medication, first thing you do also when your blood pressure is low is make sure you're hydrated. Our blood pressure is determined by the pressure within our blood vessels. What's in our blood vessels is blood. Our blood is made up of fluid. So being hydrated helps if you're trying to raise your blood pressure. But that's not a bad blood pressure. So, all right. Well, I'm going to let y'all go. This went longer than I anticipated, but it was really great talking to you. It was really great with you. We have really good questions. Please write to me at help@drtoomer.com if you think of anything else. Share this with other people in your family, your friends. Let them know to come in on Tuesdays. If they're not, then they can go to my YouTube channel and see the lives there. They are in my YouTube channel under the live tab. So you can share that. If you're listening and you're not already a subscriber, please subscribe to my channel, because that will help me actually get this out to more people. I think it's beneficial information. So if you think this is helpful and you think it's good, please share it. Share it on your pages. Share it in your, on your Facebook pages and with your family and friends, please, because the more we learn, the more that people know, the easier it will be for us to help get people what they need. Because right now there's still a lot of bias and prejudice against a lot of the ways that we manage weight, even though, excuse me, it's a health issue, but it's really important. Excuse me. Thanks, Dr. Toomer, for always being so thorough. I always am pleasure being with you. Thank you, and see you next time. Thank you for coming. Let me see. Before we go, there's a couple questions real quick. I was on a GLP-1 for 3 months and didn't lose weight. Should I try again? It really just depends on the dose. 3 months means you never got to the maximum dose of the medication. So, and it's a dose-dependent medicine. Talk to the person who prescribed it, because there may be other things that need to be happen. It also depends on which one you're on, if it was the best one for you. there are others, there are different criteria that determine which is the best one. There's different criteria to determine whether it's going to work or not. And so it's really hard to say. Length of time is not enough. Dose and type also matters. I was told that drinking too much water can lower your blood pressure. Being hydrated, what could I take? Pedialyte, Powerade, vitamin 1. No, drinking too much water. Most of us cannot drink too much water. If you're not drinking over a gallon of water a day, you're not drinking too much. If your kidneys and your heart and kidneys are working fine, lowering your blood pressure is not such a bad thing. It only lowers your blood pressure if your blood pressure is high, and then you're drinking it to get to get salt out of your system. But if you're normal, if you have a normal blood pressure and you drink water, it doesn't make your blood pressure go down. Pedialyte, Powerade, and all the others actually have potassium in them. So if you're having a problem with potassium, you do not want to drink those things. Talk to your doctor. Just talk to someone about it instead of guessing. Whoever did those tests should be telling you what to do next. I missed the segment, but I really want to know what I can do naturally to bring blood pressure down. What you can do naturally to bring blood pressure down, number one, is managing your stress. Number two is managing your salt. Number three is making sure that if it's too high, do not try to naturally bring it down. If it's high enough to give you a stroke, high enough to cause blood vessel issues, get it down with medication, then work on the lifestyle things, because high blood pressure is deadly. It's called the silent killer for a reason. So if it's slightly high and you want a chance to bring it down without medication, that's fine. But if it's high enough to cause you problems, use medication first. Don't put your body in strain and stress and put your body at risk trying to use lifestyle to reverse something that may take longer than you may not have the time to bring it down before something happens. But definitely stress management, sleep management, salt management are all important. I didn't come yet. Maybe tomorrow around noon. I'm not sure who that message was for, but maybe not for me. Okay. Shamika said, you truly are a blessing to all of us, and may God continue to bless you. Thank you so much. Well, thank you for coming. And I will see you next Tuesday. And so thank you for coming. Thank you for your questions. Thank you for your comments. It is always very helpful, and a lot of people benefit. And like I said, if anyone wants to see this, that you think it would be helpful for them, they can go to my YouTube channel, look under the live tab, and all of my Tuesday talks are there. All right. I will see you next week.